good afternoon. Thank you so much for joining us today and appreciate your patience as we get started. I'm very, very excited to be a part of this webinar today. Obviously, we're at an inflection point with the pandemic and the introduction of multiple vaccines out there. So this platform today is really about being able to ask questions and get some answers from an expert. So very, very excited to get started. So my name is Zeta Smith. I'm the CEO for Sodexo Seniors in North America. And I am joined today by Dr. Nancy Glick, who is the medical director of the Sinai Infectious Diseases Center at Mount Sinai Hospital in the Chicago area. She's an infectious disease expert with almost 30 years experience. And I was wondering, Dr. Glick, if you could share a little bit more about your expertise and certainly your personal journey in the front line of this pandemic. So, Dr. Glick?
Thank you so much, Zeta. So, as you mentioned, I am the director of the Sinai Infectious Disease Center. I normally see patients in and out of the hospital. So in the outpatient setting, I do a lot of work in HIV care. But in the hospital, I see people with all sorts of infectious diseases. And over the last year, it's really been a totally different situation. Like most places around the country and around the world, March was really the beginning of us seeing a lot of people coming into the hospital. Our beds were full and our ICUs were full with people with COVID-19. And as much as we have learned over the year, it was pretty devastating to see the numbers of people coming in, often almost always alone because of the restrictions, afraid, and really often not doing well. We had many people, unfortunately, very sick, and as in other institutions, also pass away from this horrible disease. So it has been a difficult year for myself, and I think many of my colleagues, just in fighting this virus. It has gotten better, but I think we're all concerned about another wave coming. Yes. Well, right now.
Yeah, I'm sure this has been certainly an emotional journey as well as physical, being on the front lines of this pandemic. We're going to host this today as well as next Tuesday at 8 a.m. Eastern Standard Time and next Wednesday at 6 p.m. Eastern Standard Time. And really this is about, having a platform to try to reach as many people as we can to answer questions around the vaccine. I think as you hear from Dr. Glick on really the challenge of this pandemic with everyone, the vaccines give some hope, but we have to have the facts. If you look on the internet or in social media, there's certainly a lot of myths out there. There's vaccine hesitation, and we really just wanted to provide a platform so that you can ask any question, and Dr. Glick will be able to answer or provide a bit of perspective or context around it. We are really about getting you the facts so you can make an educated decision around vaccines. So we're going to field all types of questions that will come through on this live stream. And if Dr. Glick, if you are ready, willing, and able, we will just get started with some questions. Are you ready?
I'm ready.
Okay, let's start, I think, with one of probably the most common questions. Is the vaccine safe? What side effects can I expect?
So the vaccine, so currently there's 3 approved vaccines in the United States against COVID-19. 2 of them are what we call mRNA vaccines. And then we have, which are the Pfizer and the Moderna vaccine. And then our 3rd vaccine is by Johnson & Johnson. All 3 vaccines have gone through rigorous studies Although I know people are concerned because it did occur quickly, all the studies that were done were rigorous, and they were both looking at outcomes. So was it effective or efficacious, and were they safe? So they did a lot of studies looking at the safety around these vaccines. The mRNA vaccines are a little bit newer technology, but they're actually a technology that has been studied for a long time. So we feel comfortable, and going forward, I suspect many of our vaccines will be mRNA vaccines. And they're also extremely effective compared to other vaccines that we currently have available. And just yesterday, a study came out that showed some real life information about the 2 mRNA vaccines, showing that after 2 weeks of getting these vaccines, it was greater than 90% effective at preventing infection. So compared to many of the vaccines that we currently have available, they are very safe. I mean, very effective. And also we now know that they've been studying it, and we've given them to millions of people, and they are also very safe vaccines.
Excellent. Are there any long-term effects from these vaccines?
So there's a lot of, I think, myths around long-term effect or potential long-term risk of these vaccines. And I will really just, suggest to people, if you're getting information, get it from reliable sources. There's a lot of misinformation out there, even from sources who may seem reliable. So the CDC has a lot of good information. A lot of scientific sites would provide good information. Currently, the short-term side effects, so things you may feel after you get the vaccine, you may have some soreness in the arm where you were vaccinated. And some people, especially with the mRNA vaccine, after their second dose, the mRNA vaccines are 2 doses. Though you may have some side effects as feeling very tired, achy, you may even have a low-grade fever, and that may last for a day, maybe up to 2 days. But after that, there really are no long-term side effects of these vaccinations.
Now, I have heard that's just your immune system talking to you. Is that true when you get the fever and some of those side effects you described?
Yep. So it's basically your immune system is doing what you want it to do. So it's basically saying that it's getting ready, and it's ready to fight the virus if you're actually exposed to it. I know after I got my second vaccine, I was kind of achy. I had a low-grade fever. And as much as it was not particularly enjoyable, I also knew that it was a sign that it was working. Yes. The flip side of that is if you don't have those side effects, it's not an issue. The vaccine is still working.
Okay, thank you. So there's a lot of news around the variants and multiple variants out there. What do you, I guess, your thoughts around the variants, and do they make you sicker? Are they easily transmitted? What are the effects of the additional variants that are out there today?
Right. So the variants, and you probably have heard of them from different countries.
Yes.
And that's really just from where they were first found. But we know that viruses mutate. All viruses, that's what they do. They kind of change around a little bit. And sometimes they become stronger. Sometimes they just change a little. And that's kind of what their job is. The variants the reason why these variants stand out is because they seem to be more transmissible. So if you're around someone with this variant, you're more likely to get these variants. And this could be true even if you've already had COVID. You may be at risk for getting infected with some of these variants. We don't quite know yet, but it looks like these variants may also cause a little bit more disease, more severe disease. And so there's 3 different variants, and it looks like the ones that were first seen in Brazil, especially in maybe South Africa, that they maybe cause a little bit more severe disease.
Okay. Another question that came through. So of the vaccines that are already available, is there a recommendation of one of those 3 vaccines that are available if you've already had COVID? Is there one that you should take over another?
So I think the kind of taking a step back, there sometimes people say, well, I've already had COVID, why do I need the vaccine? And you may have some immunity that lasts a while, maybe up to 6 months, but it doesn't last that long. We know that the vaccines give you more immunity, kind of more strength to fight it if you're reinfected. And as far as which vaccine to get, they're all actually really good vaccines. They all have been shown. What we want to do is keep people out of the hospital and also prevent people from dying. And all 3 vaccines are very effective at doing that.
Yes, I think there's a misconception that, okay, I'm getting the vaccine, so I can't get it, or I can't get sick. So when you hear the term effective, et cetera, what does that mean? Because people can still get sick, they just may not be hospitalized. Or so can you share a little bit on that?
Sure. So, again, the different vaccine, you'll hear different numbers for them. And what it is that there's preventing disease at all. So these, for example, the 2 mRNA vaccines were over 94, 95% effective at preventing disease. But the real thing that we're looking for is we want to make sure that people stay out of the hospital and also people don't die from COVID. And all 3 of these vaccines, if you look at the numbers more closely, you'll see that they're very effective at preventing severe disease and preventing death. It may mean that, especially if there's a lot of COVID in your community and you're exposed to it, you may still get a mild case of it, or you may not even know it, but if you're tested, they may see that you've been exposed to it. So, but that's okay, because, we want to make sure people don't get severe disease where they need to go into the hospital.
Thank you. So for pregnant women, there's a question of, they were not tested, I think, during the initial evolution of this vaccine. What are the effects there? Should they be vaccinated? I know they just started kind of testing children. Can you share a little bit of an update or current status on that area?
Sure. So I think that this is another area where I think there's a lot of misinformation out there. So in the initial studies, they did not test women who were pregnant or planning to get pregnant during the study. And that's pretty typical, because usually you try to do it in healthier people or people that are not in these potentially immune compromised states, such as pregnancy. But that being said, there were some women who became pregnant during the study. So we have a little bit of information from that. And then we also have newer information that just came out about this in pregnant women. And it looks that this vaccine is safe for pregnant women to take. It also, we saw that there was the antibodies. So if someone gets vaccinated, you make antibodies to fight the infection. And they saw that those antibodies were passed on to their babies through either the umbilical cord, so at the time of delivery, and also through breast milk. So that's a good thing, because babies don't have their own immune system and they don't have a way to fight off infections. So this is actually a chance for the mom to give the immunity to their baby to protect them for at least their first 6 months of life. So that's actually some really good news.
Yeah, that's great news.
Yeah. So, and I think there's some misinformation about could this alter DNA? And just to kind of venture into that area a little bit, this vaccine, these vaccines, the mRNA vaccines especially, even though we talk about RNA, they do not get integrated into a person's DNA. The way that this vaccine works, and I'll try to explain this in a simple way as possible, is that you're injected with mRNA, which is basically an instruction for your body to make the protein that is from the coronavirus. And so then you make this protein, and then your body's immune system is able to rev up and create a response to it. So that initial mRNA never gets integrated into your DNA, and it also gets destroyed very quickly. So there's nothing that's left over that could, stick around in your body or anything like that. And the only thing that is left is this protein so your body will respond to it.
Okay, thank you. How long does the vaccine effectiveness last?
Well, that is a good question that we just don't know the answer to yet. It's where the studies were done, we just don't know how long. We're still measuring people in those studies to see if they still have immunity. We're hoping, it could be a year, it could be a little longer than that, but we're just not sure. But that will, as time goes on, we'll have more information about it.
Okay. Is it safe to get a vaccine if you have underlying medical conditions?
It is safe. It's something that is recommended for people who are immune compromised. It's always worth, if you have any questions, to talk to your physician or your provider about that. But it is safe for people to get this vaccine. The worry sometimes is that it may not be quite as effective if you have a lot of, if your immune system is not as strong. But it is definitely safe from people that have gotten the vaccine, and it's recommended.
Okay. Another question that came in, and this may be a bit of addressing the CDC guidelines. So, do I need to wear a mask and avoid close contact with others after I have received both doses of the vaccine?
Yes, so that is a great question. And I think that, we all have to remember that we're still learning from this virus. Every day we learn more about it. But currently the feeling is that, there's two things. It's not 100% effective at preventing disease. And so far, not everyone is vaccinated. So when we mask and social distance, it's protecting ourselves about getting the virus, but also we're protecting other people from getting the virus. So currently, the recommendation is to continue masking, continue to do the things that you've been doing for the last year, and just to keep safe. You could, if you've been vaccinated and you're with other people that have been vaccinated, it's been 2 weeks, you can get together with them, but you really don't want to be in large groups in prolonged close contact. But more to come on this, as we learn more.
Yeah, there's a lot of discussion around that. So I was curious of your answer. And to your point, I think we're going to continue to learn, but at least that gives opportunities for those that have been vaccinated to be able to see people that they haven't been able to see. Yeah.
I think it's a chance, we could kind of slowly get together. I know a lot of people who haven't seen family, grandparents, grandkids. This could be the beginning of your opportunity.
What are your thoughts to that question of, the grandkids haven't been vaccinated,
right?
But the grandparents have. What are your thoughts there on how that should be handled? Still social distance, still mask up?
So, the current CDC guidelines do say that you could be with, if you have been fully vaccinated, to be with one family that, or, one group that has not been. So let's say you're, as a grandparents, were fully vaccinated and they want to be with their grandkids, the children and grandchildren. The safest thing is to, if they're going to be together, to try to be outside as much as possible, which will be more feasible as time goes on. If you're indoors, those kids, what is their exposures? Are they at risk for getting COVID? Are they around a lot of other people? And if they're not, then it's probably safe to be inside, maybe not really close together, not real large groups, but to really, you can start being together again.
Okay, that's good news.
Yeah.
Another question that came in, are there differences in the ingredients in the 3 vaccines? And if so, what are those differences?
Well, there are some differences. They are made a little differently. They are not, none of them use any egg products, so that's a good thing. We don't need to worry about people who are allergic to eggs. Really, if you've ever had a severe allergic reaction to a vaccine, then it's something that you may want to talk to your doctor about before you get the vaccine. The product, what's inside of them, the inert kind of stabilizing ingredients are a little bit different. And so they're, if you have had a severe reaction, that's something really to talk to your provider about.
Okay. Another question, what is the time frame to get the vaccine after recovering from having COVID?
Yeah, so that actually, those recommendations have changed a little bit. It was first recommended maybe to wait 3 months. Now the recommendation really is that you could go ahead and get vaccinated. You just want to make sure that you're outside of that period where you are potentially contagious or infectious. So that's usually 10 days if you've had a milder case, and 20 days if you've had a more severe case. Otherwise, it's safe to go ahead and get the vaccine. If let's say someone had COVID-19, they were given a monoclonal antibody, which people are getting to prevent severe disease. In that situation, it's actually recommended to wait 90 days because you do have immunity from that antibody, and you can wait the 90 days to get vaccinated.
Okay. So and we kind of talked about this earlier, but maybe we could dig a little deeper. Does the vaccine ensure you won't get COVID? I've heard you can still catch it or spread it after getting the vaccine. So why should I bother?
Right. So I think the reason why you should bother to get the vaccine, if you can get it, what you're trying to do is prevent severe disease. So you may not even know, let's say you are exposed to it, you may not even know that you have COVID-19 at the time. Or you may feel like like you have sniffles, or you may feel a little achy, but you won't feel sick. And that may be okay. What we're still learning about is, can you then transmit it? Some of the early information shows that you're much less likely to transmit it, but we don't have fully those answers, which is recommended, which is part of the reason why we say you should still mask, you should still distance from people. But the reality is that this is going to, no matter what, decrease your risk of infection significantly.
Mm-hmm. Mm-hmm. So we spoke about the variants earlier as well. Do the vaccines work against the variants? And I know those continue to mutate, but the variants that we know today.
Yeah, so that is also another question we're learning more about. I think that what we're seeing is that there is activity against the variants, the strains. it with some of them, and it kind of differs a little bit on the different vaccines, but there may be a little less effective against some of these variants. What may happen in the future is that we might have to get a booster for this vaccine. We may have to get another vaccine that just will help against some of the variants that have developed. They still are effective, but some of them may not be quite as effective as they are initially.
But I would assume you are still better off than not getting it at all, not getting a vaccine at all.
Most definitely. Because even if you do get infected with one of the variant strains, it looks like, you most likely will still have a milder case of COVID-19. So again, you may be a little more susceptible, but what we're again trying to prevent is severe disease, hospitalization, and death from this. So.
Gotcha. Another question, traveling. So, as states are starting to lift restrictions, we are starting to see certainly more people on the roads, but I just saw on the news more people traveling by air, with TSA reporting, double-digit increases. What are your thoughts on kind of protecting yourself or the risks associated with travel today?
Yeah, and that's a tricky one. I think we're all getting a little antsy. We're ready to do something different. We've been in our house a long time now, and
Yes.
We're ready for something else, which I fully understand. The CDC is still advising against travel. I think they're trying to figure out the best and safest way before they make concrete recommendations. I think that if someone does decide to travel, it's really important that you take the guidance really seriously to make sure you're masked, make sure that you're distancing as much as possible. If you go on an airplane, you want to keep your mask on throughout the flight. You don't want to, which means it's probably going to be a little more uncomfortable, less eating and drinking. There's good airflow through airplanes, but it's still something you have to be careful about. So, I think we're all getting ready and want to go somewhere, do something different, but I think we just want to take it slowly and safely.
Yeah, there's certainly the pandemic fatigue, and as it's warming up across the country, and these restrictions are being lifted in many states, I think behaviorally, it feels like people just want it to disappear, and maybe it's a hope and a prayer, and then that behavior follows, and then we may find ourselves in deeper trouble. So thought I'd try to understand from you just those travel risks, because everyone would love to take a trip. No one's been able to travel much for the last year.
Right, and I think we all just have to kind of take it easy on what we're doing. I think the numbers, unfortunately, right now are going back up. I know, starting to see it here in Chicago, and I know it's happening in other parts of the country. And we're not out of the woods yet. We're kind of in this race between getting people vaccinated and the variants taking over and potentially causing another big outbreak. So, continue to do those things, continue to mask and, socialize outside if you're going to do it. I think we really we're so close that we just don't want to blow it yet.
I know, almost near the finish line. So one of the conversations that continues to come up is vaccine hesitancy in particular communities, most notably Black and Brown communities. And obviously with some historical data of the Tuskegee study with syphilis as an example, there's a lot of, history that will prompt many to hesitate about trust in kind of what does the medical community recommend? Can you speak to any thoughts around that hesitancy, anything that you have heard that may help reduce that hesitancy, any work that's being done at your center regarding that? Just curious of how we can help those communities.
Yeah, so where I work is really in a community that is mostly either Latinx or African American. Those are the communities that I serve. And over the last year, the communities were again disproportionately impacted by this virus. For many reasons, people living in multi-generational houses, people having to go to work, not having the luxury of being able to stay home. And so they were more likely to get exposed to COVID. And I also know, having worked here for many years, that there's a lot of hesitancy because of what the medical systems have done historically, as you mentioned, Tuskegee. The one thing that I would say about this vaccine that's a little different is that it's not, when you look back, a lot of this was just being done almost as an experiment on these communities. Let's try it in communities where people, like in jails or in situations where people may not notice as much. But I think with this vaccine, I think the studies were rigorous. And I also think the people that have first been vaccinated are frontline workers, so healthcare workers. This isn't a vaccine where we're saying, well, I'm not going to do it. I was one of the first people to do it. And I think we just need to say that this is something important for everyone. We need to make it accessible. We need to make it so it's not, in the middle of your workday that you have to come get your vaccine, that you have the ability to get it in your community, maybe get it on a Saturday if you're not working. And also get the questions answered. If you have, I've heard people say things to me, like what their concerns are. And some of them are just really valid. Like, I'm afraid of side effects. I've heard, you can die from the vaccine, and there's good studies. So get the information that you need that's going to help you feel more comfortable, because the reality is that this is how we're going to get out of this situation. We all have the kind of individual responsibility, but we also have to do it for our community so that we can actually get out of this pandemic and go back to normal, or at least semi-normal living. So I think, I don't think there's one easy answer to that question, but I think that it's kind of a multi-pronged approach. And I think one of the best things is giving people the opportunity to voice their concerns about it.
Yeah, and I think that's one of the reasons we're even having this conversation today is, the hesitancy and the myths and the history, et cetera, and the trust. If you start speaking to facts, speaking with individuals like yourself as experts, you learn a lot more, and then you can make a better educated decision on getting the vaccine. So I appreciate this conversation. One of the myths that it's actually one of the top myths on social media is around young women and their reproductive organs being impacted by vaccines. So hearing a lot of women in their childbearing years not wanting to get a vaccine because they fear it will impact their fertility. Can you speak to that?
Yeah, so I've heard a number of different kind of like, where is that myth coming from? And I think there's a number of places that it's come from. I think there's one idea out there that it's similar to the hormone that we secrete, that there's something to do with it, like it's similar to the beta HCG. I think that I've heard a few different things, that somehow will get integrated into the eggs that women carry. And what I would say is that we're working to study this vaccine in pregnant women, but we also know that there was a lot of women who've participated in these studies. And we know that, as I mentioned earlier, that this vaccine in no way sticks around in your body. It doesn't get integrated into your DNA. It doesn't get taken up by eggs or reproduction or taken up into sperm. So there's no way that this vaccine sticks around in your body to cause issues down the line. I have heard that from a number of people, and it worries me, but I think that, it worries me that people are concerned about it, but there doesn't seem to be any basis for that concern. And that this is something, especially if you are thinking of having children, it would be something to take to protect yourself against COVID.
Yes. And social media, it takes just one person and then something can go viral and then it becomes someone's truth. I know that, first off, these questions coming in have been fantastic. I'm going to give kind of last call for any remaining questions as we come up to the top of the hour, but we have just a few more. I'm curious as to some of the other vaccinations and timing of those. So if you're over 50, getting the shingles shot, the flu shot, can you get those within a certain period of time of each other? Does it matter? Are those all still recommended? What are your thoughts there?
Yeah, those are some good questions. And one thing we've seen, unfortunately, especially in kids over the last year, is a falling off of vaccines, that people aren't getting their routine vaccines done. And we really want to make sure that we get people vaccinated still. With this vaccine, though, it is recommended that you do not get any other vaccines within 2 weeks of getting your COVID vaccine. So, for some people, if you're getting the mRNA vaccine, you get your first shot, and then either 3 or 4 weeks later, you get your second shot. So you should wait for 2 weeks after you finish the series to get other vaccinations. We're out of flu season. Really, we're getting to the end, if not out of it now. And we fortunately had a very mild flu season this year, thanks to masking and gloving and not a lot of close contact. But so that's not a worry till the fall or, late fall. Other vaccines, I think maybe for kids to think about, what vaccines do your kids need? And maybe this is a good time to do it, with the hope that by maybe the fall, we'll have the COVID vaccine ready, and that should take priority.
And you did mention that there's possible boosters that may come. So is it a little too early to know what that may mean for the vaccine series?
Yeah, it is a little too early. I think that we'll probably have more information about that perhaps this summer, just to know if we're going to need another vaccine. But it probably would be at least a number of months away.
Okay. The question that just came in, I think we talked about it, but want to just make sure we address it specifically. Is it assumed then that as we're getting these vaccines, it won't be a once and done, that there'll be more of maybe an annual or some type of frequency where we'll have to get a vaccine?
I think there's a good chance. I think there's some discussion, whether it's annually, whether it's every other year, whether we see it a little sooner with getting a booster vaccine because of the variants. There's most likely this will not be a one and done type of vaccine.
Okay. And with the Johnson & Johnson, which is a one shot, yeah, is that any different than the other? We would still be talking boosters. We would still be talking the same type of series?
Probably. You know, the Johnson & Johnson there was more COVID around when it was approved. So there was, you know, the efficacy was looked at a little differently, but there is a chance as well with the Johnson & Johnson that there'll be another, either a booster or another vaccine necessary.
Okay. As we get closer to the top of the hour, I would love to just give you the floor, Dr. Glick, and just share, you know, you've seen a lot, you've experienced a lot, I'm sure you've felt a ton over this over a year now of trauma and challenge, et cetera. And now we have a vaccine, but just would love to give you the floor just to share your personal thoughts on where we are today.
So, yeah, I mean, I think it's been a remarkable year for better and worse. I think that, again, as I started out with, I think most people in healthcare who've been on the front lines really have never experienced anything like this. And the number of people that we have seen so sick and often so alone was traumatizing, both for people and for providers. And it's something that I know will take all of us time to really recover from. I think that this year's also been difficult because there's been an overlay of misinformation. And we've, instead of making it as a, you know, we need to approach this together as a community, there's been a lot of information that's just not true or helpful. And the reality is we are all, you know, we're all interconnected. It's all, this virus doesn't care what community you live in, what, you know, what political, racial, ethnic, anything. You're at risk for it. And we all have to approach it that way. The vaccine is our way out of it. I think that, you know, as much as like there's been incredible scientific breakthrough as far as potential treatments for this virus, the fact that we already a year in have a vaccine that's so effective is really our way out. And I know when I got my vaccine, I, you know, started crying because it felt like for the first time in a long time, I felt hopeful. So I just encourage people to learn what you need to learn to feel safe to get this vaccine. The rollout has been, I think in the next probably month or so, it should be available to almost everyone, and really do what you need to do to get vaccinated.
Well, I think you said it very well. I want to thank you, not just for sharing your level of expertise, but for the work that you've done, that you were doing well before this, but certainly during the pandemic, knowing that you probably were personally and professionally impacted by it. So thank you for your work. I'd also like to recognize all of the front line that are out there that have been working through this pandemic every day in some ambiguous situations, and certainly some sad ones and some challenging ones as well. But to Dr. Glick's point, there is hope. And in getting educated about the vaccine, we weren't even in a position even just months ago to even be talking about a vaccine. So the fact that there are now 3 and more vaccines that are going to be made available, the hope is that everyone does get educated and does get comfortable to make a decision in getting the vaccine so that we can get back to some semblance of normalcy. Let me just close with a reference for you that if you go on the website, and I'll give you the information here, www.us.sodexo.com/get-the-facts. I'll repeat that, www.us.sodexo.com/ get the facts. This is available for everyone that is interested in learning more about the facts around the vaccines that are out there, and hopefully will provide a bit more reassurance of the process in which they were introduced to us. I really, again, would like to thank all of you for your time today. As I shared at the beginning of the call, we will provide the same platform next week, next Tuesday at 8 a.m. Eastern Time for East Coasters, and then next Wednesday at 6 p.m. Eastern Time, probably more so for the West, but if you're right before dinner, if you're on the East Coast, you're welcome to join us as well. And again, we will have a panel of experts to help share. My thanks to Dr. Glick again for your sharing and certainly the sharing of your expertise. And my thanks to all of you who took the time today to listen in. We'll see you soon. Thank you.